So let's talk about the renal replacement therapy options for just a minute. So transplantation, it sounds like you have done an amazing job if you get people a transplant before they even see dialysis. I'm sure that's a much happier experience and much more positive experience for that patient. But what's the challenges? How do they find a transplant? I know there's a list. I hear that it takes a long time. What is the strategy to get a transplant before you need dialysis?
It's a very organized effort between us and the transplant centers. We communicate with and arrange referrals to two different transplant centers, one in South Carolina and one in Georgia. We communicate with them, and when we see the patient is interested and qualified, not everybody qualified for transplant. But if in our judgment, primary judgment, is the patient might qualify for transplant and the patient has interest, we refer them to the transplant centers. And when they go to the transplant center, there's extensive interviews about different things to make sure the patient is a good candidate for transplant. Transplant is a huge deal. It needs commitment. It needs the patient to be responsible, reliable, accountable, and in decent physical condition, and have a good family support, and of course, financial coverage also a factor. So when we send them, they go through all this, interview the patient from psychological perspective, from physical perspective, from financial perspective, interview the family, and make a distinction between the two different options, is whether it is going to be cadaver transplant from somebody who just passed and donate the kidney, or from family member who wants to donate the kidney, living related kidney from a wife or a husband or a cousin or something. That could be also arranged. And if that's the case, they interview the donor also, physically, psychologically, financially. They make sure that is an appropriate decision, an appropriate choice between the donor and the recipient.